Central Illinois is the CI in CI Living.
Well, our yearly wellness exam isn't something we always get checked off our to-do list. Taking care of our health as we age is something we need to do daily.
Today's sponsor, Carle Health, offers resources to help us stay on track. And Kristen Cole, Director of Population Health, Clinical Improvement, is here with us with more information. Kristen, welcome. We're happy to have you.
Welcome.
Okay, let's talk about these wellness exams because Grace mentioned, you know, it's important to have an annual exam. A lot of people kind of skip those, forego those. At what age is it really important that you are keeping on track of that?
Yeah, so wellness exams are truly recommended for any patient, regardless of payer, starting at the age 65, moving forward up through the end of your lifespan. So anyone 65 and up is 100% eligible, and it's extremely important that they have these conversations with their clinical team and with their providers.
What does a wellness exam look like? What does that entail?
So when you have a wellness exam, what you really focus on is come in, you will meet with either your provider or one of your clinical team members. And what we truly try to focus on is we do a robust review of your past medical history, your past surgical history, your immunizations, make sure your medications are up to date in your chart, so a pretty thorough chart review. And then after that, we dig right into more of a health risk assessment and talk to you about any of your preventative care needs that you might have.
When it comes to preventative care, it seems like things are always changing, like with the recommendations, like, oh, now you need to get it at this age. Oh, before it was this age. How can you keep up with that and know, oh, I guess I missed that, so
yeah.
Too late for me. I don't know.
I think there's multiple ways that you can keep up with that. I think that one thing, as a Carle patient, if you are signed up and have our Carle Health digital platform, you will receive alerts when you're due for any of your preventative wellness exams or colonoscopies, breast exams, etc. But that is truly the purpose of a big piece of this visit itself, is you're meeting with a clinical staff member. They've reviewed, they're up to date with what those current guidelines are. And like you said, they change all the time. And they will do that chart review before you get there to make sure that you are not being suggested for something you're not due for. They'll dig in, give you that education. Why is it important that you still have a colonoscopy, etc.? And when are you due for that? So they take all of the guesswork out. You will also leave with a preventative health care plan. So you'll have a nice piece of paper that may say you weren't due for this today, but you're due in 2025. So you have that right there for you.
Well, that's nice that you're walking away with that, because it can become overwhelming, like, oh gosh, what all did they say?
Right.
Yes,
Right.
definitely.
So and I think there are people out there that are a little bit reluctant to do that annual exam because they think, maybe I feel fine right now, I'm good, I'm just going to push it off a little bit longer. Before you know it, it's years later.
Yes.
And it never happens.
Yes.
So it is important to get in and actually make that happen. What does scheduling an appointment look like with you guys, and who is eligible to do that?
So again, it's that patient population 65 and up. You can schedule an appointment multiple different ways. So you can reach out to our Carle Scheduling Center. That phone number is 217-383-3200. If you have a MyCarle account, you can also schedule yourself via MyCarle. It's called a Medicare Wellness Visit type. Or if you don't have a MyCarle account, you can actually go to carle.org and sign up for one.
Let's also quickly touch on the medical power of attorney aspect of things, because that seems so important, because honestly, you don't know what's going to happen tomorrow.
Yes.
And it's important to have those kind of things set up in case of an emergency, like, I don't know. I don't want to go there, but it's important to have that set.
It is. So that's one thing that we always, when we kind of prep patients before they come in and have a conversation with them, we tell them to bring in their healthcare power of attorney forms if we do not have them on file. If the patient does not have them, we do have a very high-level conversation, again, as to why it is important to start thinking about who you want as your healthcare power of attorney. If the patient is agreeable, we will get them set up to come back in the office sometime, and they can actually have a free facilitated visit where they can learn more and talk to a trained staff member about what are your wishes in case you were in an emergency. How do you communicate those with your family? So very important to have those on file.
All right, and that's where our friends here at Carle come in to help you walk through all of those steps. Thank you so much for being here.
Thank you.
All right, we will connect you at CILiving.tv, and we do thank Carle Health for sponsoring our segment today.
All right, coming up later.